for this presentation, I'm going to do changing an incontinent product or pad or brief. So before we start, I would have to put on gloves, and we would need cleaning products such as wipes or washcloth for the client. So I'm going to pretend to put on my gloves, and I'm going to change it, and then I'm going to put it back on. So first of all, I'm going to untie these. I'm just going to slightly tape them back here, and I'm going to do the same for this one and this one, because we don't want the tapes to be sticking to the client's skin. And I'm just going to slowly do this. I'm going to crisscross the client's feet because I want to turn them to their side. I'm going to slowly turn them to their side, help them, and supporting their body. I'm going to try and tuck the pad under as much as possible. I'm going to take out my incontinent pad, and then I'm going to put it in the garbage bag that is right here. And then, while supporting the client, I'm going to take a new pad. I'm going to roll this up. I'm going to tuck that, and I'm going to slightly do this. I'm going to try and put it under the previous pad, and I'm going to push it as far as possible. And I'm then going to take the incontinent product. I'm going to try my best to tuck this side under while supporting the client as much as possible. And if this is pee or feces while we take off the old incontinent pad, we would perform perineal care. So we would use wipes or washcloth. And I'm going to slightly push this under as much as possible. And while I'm doing the procedure, I would tell the client what I'm doing. And then I'm going to slightly roll back the client over to the pad. And then I'm going to try and push this out. And then I'm going to roll this. I'm going to remove this, and I'm going to pour it in the garbage bag. I'm going to bring this under the new one that I've changed. I'm going to try and level the the incontinent pad. I'm going to try and level that, making sure that it's a right fit for the client. And I'm then going to try and bring this through. And I'm just going to attach the tapes, not too tight and not too slack. I'm going to push this under. I'm going to attach that. And I'm going to attach that. And while I'm doing this, I would do observations such as if there's any redness or irritation or any sores. And after doing this, we would perform post-procedure. I would remove my gloves, perform hand hygiene, and I would put back the blanket over the client and do post-procedure. Thank you.